Welcome to Spotlight. I'm your host, Amitha. Join us weekly to get inspired by guests who will share their success stories. Canada India Foundation's exemplary work to foster bilateral relations between Canada and India is achieving greater heights with every successful theme-based forum that it holds. Today, we'll be talking to two guests who will shed further light on the upcoming Canada-India Healthcare Summit. We have Dr. Arun Chockalingam, Professor of Epidemiology and Global Health at the University of Toronto, and he is the chair for the technical committee for the upcoming summit. We also have Mr. Kalyan Sundaram, who is the past executive chair for the Canada India Foundation and a current independent consultant. He is the publicity chair for the upcoming summit. We welcome back to our show these two inspirational guests. Thank you, Dr. Chokalingam. Thank you, Mr. Sundaram, for being with us today.
Thank you, Amitha. It's a pleasure to be back with Spotlight.
Thank you, Amitha. Same here. A pleasure to be back and look forward to the interview.
So our viewers have been given a little bit of information previously by Dr. V.I. Lucky Lakshman and Mr. Satish Chakkar about the Canada-India Healthcare Summit that's about to happen. So now let me turn to Dr. Chokalingam first and ask you about your expertise opinion about what's happening in the world with the COVID-19 pandemic from a global health perspective.
Amitha, it has taken us completely by surprise. This little virus, which started in Wuhan, has completely taken over the world, and it made all of us speechless. And we have got to cover ourselves, and it has a dramatic influence on the entire population of the world. And this one particular disease has claimed the lives of so many people in such a short time. We have got about, say, 2.5 million people worldwide died just because of COVID, and nearly about, say, 112 million people have been affected. But fortunately, many of them have recovered, and the number of deaths is not acceptable, and it varies from country to country. And there are some countries which have done a phenomenal job to control it, and some countries like United States have failed miserably. And even in Canada, we cannot be proud of what we have done. It's all because we were not prepared for it. The pandemic preparedness is not there. It's more like a war. We have been taken up totally unexpected, and the virus is winning the war so far. Hopefully we can put an end to it.
Very well said. Yeah, the key is being prepared, and that's what we weren't prepared for. So when we hold information sessions like the upcoming summit, it's very useful, not just for the information, but also for exactly what CIF does to allow for that collaboration, between two countries. So I'm going to turn to Mr. Sundaram and ask you to shed some light on the past, forums, not just the healthcare forums, but in general, all the forums, you've been part of it. And you've had two prior healthcare forums. So give us some information how that has gone in the past.
I think the Canada-India forums, the idea of Canada-India forums was first visioned in 2009. And I think, as you mentioned before, you referred to Dr. Lakshmanan. I think he's the inspirational person behind and the visionary behind the idea of a Canada-India forum to discuss policy-specific theme sector events where experts from the two countries, from the government, public sector, and academia can come together and discuss areas of interest, look at what is happening, look at areas of collaboration, and make policy recommendations to the respective governments. We started off with the Energy Forum, which was a great success, thanks to the help from the Government of Ontario and several sponsors. And the success of that encouraged us, it encouraged Canada India Foundation and Dr. Lakshmanan to suggest, to think of other themes with which you can run these conferences. And so we followed up with with the mining and metals in 2010, with agriculture and food processing in 2012, infrastructure in 2014, and healthcare in 2015. These took place in different cities as well. I mean, somewhere in Toronto, like the energy mining was in Toronto, agriculture was in Vancouver and Saskatoon, infrastructure was in Ottawa and Toronto, and then first healthcare summit was in 2015 in Toronto. The healthcare summit, I think it caught, I think even though there were all several themes, the healthcare summit, it became very apparent that this is a theme that touches everybody. Other themes probably touch the business sector and some specific people, but healthcare covers all of us. Everyone is interested. So the interest in the healthcare summit was so great, and we got a lot of requests to do a similar event in Delhi, in India. And we chose New Delhi as the venue, and the second healthcare summit took place in 2017. And it was again a great success, first because it was held in Delhi, and the quality of the participants and the panelists and the expert speakers from the Energy Forum all the way to the second healthcare summit was quite phenomenal. And I think that is the key objective and the key achievement of the Canada-India forums, is that it creates a profile. I mean, there are lots of technical forums and lots of experts who discuss these things all the time. But the difference with Canada-India forums is that it creates a public profile. It brings in the government people together, the private sector together, and the academia together, and shares knowledge and disseminates information and develops policy recommendations. That's what makes it unique. So it is again the same thing, that the healthcare top theme was so significant, and all through last year we have stuck with a scenario that has been unprecedented in the history of the world, even including the Spanish flu. I don't think we have seen anything like this before. I think it is imperative that we hold another healthcare summit, in this case focusing on COVID-19. And that's how there we are right now. And we have just made a beginning first webinar. And I think that with May 20th and 21st, when the summit will take place, it will be a great event and hopefully of benefit to everybody, especially in the Canada-India corridor.
Absolutely. I mean, healthcare is of utmost importance in this day and age with the pandemic. So it's great that even the focus has been on COVID-19. But let's go to Dr. Chokalingam, because you are the chair for the technical committee for the summit. Tell us what considerations were taken when you decided about how the summit should be this year and what the theme should be this year.
Thank you, Amitha, for that great question. When we planned the summit, a lot of thought has gone into it. So what should we talk about? Should we talk about the pandemic per se? Or what else can we talk? Because every single day, people are inundated with the data, and the data is not good. And it says how many people died and how many people are suffering, and there's no vaccine, there's no cure, and so on. So we took a kind of an approach that will lead to what are the ways and means we can prevent the COVID-19 as well as any future pandemics. So with that in mind, we looked at what are all the components that will mitigate the COVID-19 likes. So we looked at biotechnology, through which vaccines are developed, the drugs are developed, and even certain disinfection methods are developed. The so-called PPE, everybody is aware of it, personal protection equipment. So these are all some of the ways and means. So that is one angle. And the second is, with the advancement of technology, with the exponential growth of artificial intelligence and machine language, how can we deploy that? And how is it being deployed in this COVID-19 pandemic? And the third area that we thought was, are we doing right things? Are the governments doing right things? Have we been prepared? What are all the preparations and innovations required to deal with COVID-19 likes? So with that in mind, we have constituted 3 separate committees in which we have brought in experts both from India and in Canada to discuss. So this is a work, a background in the background going on. So there are about, say, somewhere between 6 to 8 people in each of these committees working very diligently, sharing their knowledge, and putting together what is called the webinars in between. So these webinars are leading to the summit in May. So we had one such seminar yesterday, one such webinar yesterday. It was on biotechnology. It was received extremely well. What we did was we had 4 speakers to speak on 4 different angles on biotechnology. Everybody is keen on vaccine. We did talk about vaccine. Then we also did not want to forget about the nutrition and lifestyle. So we have got an expert speaker from Winnipeg who spoke on the nutrition and its role during the COVID and the effect of COVID on nutrition. And then we have got another speaker who spoke on cell and gene therapy. While gene therapy is very expensive, that is an upcoming field. So we just want to bring that into focus. And then the 4th speaker also addressed how we can disinfect all the devices that we use and disinfect the rooms using ultraviolet C component. So it was quite well received and there were quite a number of questions that arise. So what we are hoping for is we use the webinar as a tool and generate the questions from the public and the audience. And these questions will be taken into account to write what is called a white paper. And these white papers from each of these committees will emanate, and that will become the basis for our recommendations to both governments, both Government of India and Government of Canada.
Wow, that's amazing. A lot of work going into the 2 days of the summit, but as you already mentioned about the webinars, how it's leading up to that. And in the end, there's a plan to get people involved and take action. It's not just about discussions and about providing information, the goal being action at the end. So we have more to talk about the summit, but before that, it's time for a short break. Welcome back to Spotlight. We are talking to Dr. Chokalingam and Mr. Kalyan Sundaram about the upcoming Canada-India Healthcare Summit by the Canada-India Foundation. So this is great. Now we have heard about how the summit's theme came into play. We heard about the webinars that have taken place that lead up to the discussions. And at the end, we have the goal for the government to take action and also for the public to get involved. Now I'm going to turn to Mr. Sundaram and ask you to elaborate on the team behind this. We already heard there's a big team behind this, but one main player, the Federation of the Indian Chambers of Commerce and Industry. So enlighten us about their involvement in this summit.
Thank you, Amitha. As you know, Canada-India Foundation has been organizing these forums from 2009 onward. And of course, he's playing the leading role in organizing this event as well. This time, we are very fortunate that we have had multiple partners. As you can see in the top of my background screen, there are 4 organizing partners in this event: Canada-India Foundation, the Consulate of India in Toronto, the UHN, specifically Toronto Rehab Institute, and most importantly, FICCI, as it's commonly known as the Federation of Indian Chambers of Commerce and Industry, which is the largest business organization in India. And it's got a major element in that organization focusing on healthcare. And we are very fortunate that the healthcare team of FICCI is partnering with us in organizing this event. The chair of the FICCI Health Services Committee, Dr. Alok Roy, is one of the key members of the organizing committee for this event. And in addition, there are 3 other members of the Healthcare Services Committee from FICCI who are taking part here. The big advantage of having FICCI take part in this event is that we have a strong Indian participation. It's not just something an organization in Canada is driving for both Canada and India. We have a strong Indian organization. And in keeping with that, this particular event, this forum on May 20th and 21st, which is the first virtual forum that we are doing. All the events before have been physical events. This is the first virtual event we are doing. And we expect strong participation and attendance from both Canada and India. So with that in mind, the event is going to take place in the mornings here in Canada and in the evenings in India. And we are expecting a lot of attendees. We already have a good number of registrations from there. And we want to thank Vicky for help making that possible, and also to get us a lot of good speakers as well. So I think that it's a good beginning. We hope that future events will have similar strong Indian partners in such Canada-India forums.
That is amazing. I mean, you're going with the times, and this pandemic lockdown has not stopped you, and definitely we are going virtual. So this is great, a great partner involved in the summit. And you already mentioned about healthcare partners who will be part of the summit, but I'm going to turn to Dr. Chokalingam and ask you to elaborate on the main players.
Can you repeat your question, please?
Yes, as Mr. Sundaram mentioned on screen, we can see that there are healthcare partners involved as well. If you could elaborate on those healthcare partners.
All right. We also have got UHN, the University Health Network, which comprises of all the major hospitals in town, and the Faculty of Medicine and the University of Toronto as partners. So we draw a lot of research eminence from these people, both in the field as well as in the upcoming research. And we have got the strong support from the Consul General, Apurva ji. So she is quite instrumental to get some of the eminent speakers from India. Sometimes it's difficult for us to reach out to them, but as she is able to use the government machineries and through the government systems, so she's able to get some of the top speakers for the main summit. And of course, FICCI is quite involved. FICCI has nominated a few people to serve on the subcommittees, which are leading to the webinars, and then they will also be contributing. So I'm quite positive that with such partnership and the dedication from all of them, including CIF, we should have an excellent outcome, and hopefully this will all lead to putting the COVID-19 to bed so that we will all come back to so-called life, so that even the new normal should be close to as the old normal. So that's what we are striving for, and such things cannot happen without strong partnerships from everyone concerned. This is a global problem, and we need to find global solutions. So we are beginning with Canada and India, and we have got some supports and speakers from different countries who join from time to time. So I am very hopeful that we will achieve our goal.
Well, very well said, Dr. Chokalingam, and hats off to Dr. Chokalingam, Mr. Sundaram, and the entire team. I mean, if we have witnessed all the past successful forums, we are very sure that this is going to be successful too, because it's about the team coming together, and there is a sincere goal here to bring about change, to be able to bring that relation between Canada and India stronger, and also dealing with the most relevant topic of the time. So for sure, it's going to be a success, and we, if we look at from the public perspective, very grateful for that, so that things like this don't happen in the future, and we are better prepared for anything like this that may or may not happen. So we have more to talk about, but it's time for a short break. Welcome back to Spotlight. We are talking to Dr. Chokalingam and Mr. Sundaram about the upcoming Canada-India Healthcare Summit by the Canada-India Foundation. So now we have a better idea about what the Canada India Healthcare Summit is about, the what went into it, what we can expect. So, Mr. Sundaram, now enlighten us. We know it's happening on May 20th and May 21st. It's a virtual event, but where can our viewers get more information about it?
Oh, thank you, Amitha. Before I say that, let me just throw in a little teaser. We haven't talked about the great speakers who are going to be speaking at the summit. There's a very strong list of speakers, and we won't have time to go through all of them. But I just want to throw in one teaser. The CEO of Bharat Biotech, the famous organization in India, which is responsible for the production of Covaxin, which is going to be saving the lives of millions of people in India. Dr. Krishna Ella is going to be one of the keynote speakers at the event. And we're very, very happy about that and grateful to the Consul General for facilitating that. Number of other speakers as well. But the information about all the speakers and the event and the schedule, everything can be found in the website that has been created just for this event, which is www.canadaindiahealthcaresummit.org. And so that website will be updated continuously with the new speakers, including prominent government speakers as well. Another place to go to would be our Twitter account, which is at CIHS_2021. And then again, there you'll see the latest updates on that. And as always, Canada India Foundation can be reached for information, and their website is www.canadaindiafoundation.com. And specifically about the event itself, I think it's going to take place on May 20th and 21st on the mornings in Canada and in the evenings in India. And it will be preceded by 3 webinars, one of which has already taken place, which is February 24th, yesterday, 25th to 24th. And the next 2 webinars are going to take place on March the 10th and March the 25th. So the 3 webinars and the 2-day summits will make up the whole summit. And just one more thing that I want to add here is, and we don't have time to discuss in detail, but hopefully we'll do it another time. It is that the summit is going to also include a competition to recognize and reward entrepreneurs in the healthcare sector who have come up with innovative ideas. So I think that's going to be, it's going to be a great series of events, and we are looking forward to it.
Absolutely great. Yeah, everything that we discussed here today is quite, enticing to be part of the event, because as we mentioned, this is what we need for this day and age. Dr. Chokalingam, do you have any further comments about the summit?
Well, if you really look at the whole thing, it is going to benefit the public. It is going to benefit the government to government, the collaboration. It will also enhance the cooperation between the industries both in India and Canada. See, the Indian market of 1.3 billion or 1.35 billion people, and many of the technologies that are being developed in Canada, either biotechnology or artificial intelligence, or some of the policies that we have, because the Canadian healthcare policy is considered to be one of the best in the world. So some of these things will have major applications as India is developing the universal healthcare for its 1.4 billion people. I think that's a challenge that they have. But at the same time, Canada can also benefit from the pharmaceutical hub of India. India provides 70% of the pharmaceutical supplies for the whole world. So that is their capacity and that is their strength. And even in this time of pandemics, there are 2 major organizations in India who are producing billions of doses. One is partnering with AstraZeneca, that's the Serum Institute of India. They have taken a chance even before it was approved, and they prepared billions of doses, more like a gambling. If it works, they can sell it. If not, they will lose it. And that is the cheapest drug available today. In comparison, the AstraZeneca, as well as the Bharat Biotech's vaccine, they both are about $4 a dose, as opposed to $40 for the Pfizer product. So there's a 10 times difference even at the cost itself. And to make it available, India has been generous to give a lot of support through Gavi, through WHO, to many of the poorer countries. And so that philanthropy is there. And even Canada, when we had some short supplies from Pfizer last month, we reached out to India, and India has agreed to give us 2 billion doses. So there is the sign of cooperations, which I hope will pervade both in preparedness, in scientific research, and in industry collaborations. I think that is the main objective of all these forums, to bring about close collaborations between the two countries. We both are Commonwealth, we both are democracies. So if you look at the slogan of the Canada India Foundation, which says democracies working together.
Yes, so our viewers have the information now where they can register, but definitely it's bringing together the best of both worlds, and major players who can make a difference, understanding it better, and then together make a difference to action involving the government of both the countries and also the game changers. So Dr. Arun Chockalingam, Mr. Kalyan Sundaram, it has been a great pleasure talking to you today, and always a pleasure learning about what Canada India Foundation does and gets to better heights in bringing Canada and India closer together. We wish you all the best. We know where to find information about the summit, and our viewers will be registered. I'll register. We will see you there virtually during the summit.
Thank you.
Thank you very much.
Thank you. So now we have better information about the upcoming Canada-India Healthcare Summit to be held by Canada-India Foundation, and how it has relevant topics and themes to bring the world closer together. Well, that's a wrap for this week's show. Thank you for watching us. Follow us on Facebook and on Twitter, and write to us at spotlight@ethnicchannels.com. Until next week, this is Amitha signing off, encouraging you to support game changer organizations like Canada India Foundation.